Hi, Rising Tide Scholars. My name is Brandon Johnson, and I completed my entry level DPT education at Regis University. I then went on to complete a residency specializing in orthopedics at Regis University as well. And I am now a board certified orthopedic clinical specialist. What ultimately inspired my path to physical therapy was my own fitness journey. I grew up as an obese child, about 200 pounds overweight, with riddling comorbidities, pre diabetic, health issues, as well as some sports injuries that led me on the path to physical therapy. I had plans to play collegiate football until these injuries happened. And as one door closed, another door opened. When I was at the University of Florida, I majored in applied kinesiology, physiology, where I was able to learn more about the anatomical system and the physiological system and how these two systems work synergistically. I also became a certified personal trainer and a certified strength and conditioning specialist and worked in the fitness industry for about 10 years. Over the course of that decade, I realized that I was unable to manage my clients at the time to my highest potential and highest capacity, which put me on the path to physical therapy because I know that we are the movement experts and experts in diagnosing and managing musculoskeletal impairments as well as deficits. When I applied to physical therapy school the first time right out of school, I did not get in. Now, this failure didn't set me back. It only lit a deeper fire in order for me to do more and pursue more education. So I decided to go back for my master's. I received my graduate education in applied kinesiology and physiology. However, this time specializing in human performance. After gaining this higher level of knowledge and continuing to work as a certified strength and conditioning specialist and personal trainer, I was able to have exposure to collegiate athletics at the University of Florida. This allowed me to work with athletes, relate to athletes, and also get a little bit of managing athletes from the personal training side of things. But ultimately, I was able to take away from that experience more knowledge on the physiological system, more knowledge on the anatomical system, dovetail those two aspects while also bringing in the concepts of sports psychology as well as neuromuscular physiology and getting a deeper understanding of how all of these systems work together. I then reapplied to physical therapy school and got in and decided to attend Regis University. I decided to attend Regis University because of the values that they instilled within their program. I encourage you all to look up and familiarize yourself with the Jesuit values because I realized that there are values that I had instilled in myself as I was growing up and going through schooling and things like that. After graduating from Regis, passing the board exam, and obtaining my doctorate, I found myself working as a solo practitioner. In this field, I was working managing motor vehicle collision patients, which can be a very highly complex demographic. But I was also working as a sole practitioner. And the deficit to working as a sole practitioner as a new grad is that you don't have the collaboration or the mentorship that some might need in order to manage patients effectively. And I noticed this deficit in myself. I was still managing patients and treating them to the best of my ability. However, I had no formal individual or group of people to help me with some difficult cases. So I decided to pursue the Regis residency in orthopedics because of its hybrid setup. I was able to maintain my job and work full time, but also attend residency and receive the mentorship and advance my clinical decision making skills, and my clinical reasoning all in one comprehensive package while I was still able to manage the patients who are currently on my caseload. This was the greatest thing I could have done for my career path because now I find myself very confidently able to treat orthopedic conditions, but also I feel as if my clinical reasoning and decision making skills have accelerated to about 5 years ahead of where I originally would have been should I have not done the residency education. But I also had an opportunity to learn from some very, very established mentors in our field. And these mentorships and these relationships, I believe, are ultimately the crust of residency education because you're able to learn from seasoned practitioners. You're able to talk to them about what mistakes they made from a clinical perspective, how they overcame those mistakes and challenges. And you can take those experiences and those stories and mold them into your clinical practice to become more of a robust, comprehensive, efficacious, and holistic clinical practitioner. One question I get a lot is if a physical therapist has a doctorate, why aren't they recognized as doctors? So let's clear that up. Physical therapists earn a doctorate of physical therapy degree, which is a clinical doctorate. Just as dentists have a DDS and pharmacists has a PharmD, physical therapists hold a DPT. So yes, PTs are doctors, specifically doctors of movement and musculoskeletal care. But the reason society fails to recognize that is most on historical implications. For decades, PTs were seen as technicians or support staffs who simply carried out what the physician ordered. Now, it wasn't until the early 2000s that the profession rebranded and transitioned to the doctorate level training because of the individualized care, evaluations, diagnosis, and treatment planning that we provided. So the public perception ultimately is still catching up to the education. Another factor is the traditional medical hierarchy. Many people assume that only doctors are the ones who prescribe medication, but physical therapists diagnose within our own scope. We diagnose movement dysfunction, orthopedic conditions, and mobility impairments, as a few examples. And we manage them directly. Also, in all 50 states, patients are able to see a physical therapist without a physician referral through direct access of care, which means PTs can function as frontline providers for musculoskeletal conditions. The challenge is ultimately that our profession has historically been humble about our title. Meanwhile, other fields like chiropractic or dentistry, for instance, have consistently introduced themselves as doctor, which shape public perception and understanding over time. So, part of shifting perception is simply owning the role that we already have. So, when I introduce myself to a patient, I say, "Hi, I'm Dr. Brandon Johnson, and I'm a physical therapist, but you can call me Brandon," in a professional, accurate, and clear manner. As the field continues to expand in primary care, sports and performance, military and tactical, medicine, I think the public recognition will continue to shift. And that's a good thing because when people understand what physical therapists actually do, they get better access to the care in a timely manner, but there's also a higher degree of therapeutic alliance. What I'm doing to bring recognition to the title is by modeling the way, sharing an inspired envision, challenging the process, and ultimately encouraging the heart of young, pursuing, aspiring physical therapists to understand the process and education that they go through and the diagnosis that we make and the management plans that we come up with. I also believe that residency and fellowship education is a step in the right direction to further recognizing us as a doctoring profession because it shows that we are specialized in a specific realm and are considered additional higher level of experts in that realm, which will overall help the branding and the name and the recognition of physical therapists as doctors. Burnout is a real epidemic within our field, and I believe that it can be avoided with the right tools to success. Those tools are proper nutrition, high quality sleep, consistent exercise, mindfulness, positive social interactions. I find that my brain and my body work best when I provide it with the proper sustenance to perform. I make it a goal to get high quality sleep. I also make it a goal to hold myself accountable when it comes to my activity and my exercise levels. Now, not to get into the weeds of the research, but it's been very heavily researched the advantageous aspects of good sleep, good nutrition, consistent exercise, and positive self talk or positive thoughts and mindfulness, but also having a good social group. Now, whether that be family, whether that be friends, whether that be activities outside of school or clinical practice. What that looks like for me is live music and concerts and nature. I am very blessed to live in Denver, Colorado, where we have an amazing and alluring nature environment to really ground yourself and escape from the stress of life. Denver and Colorado in general has a great music scene, so a lot of the artists and the type of music that I enjoy really fills my emotional cup, comes through, as well as the people I interact with are amazing people. They're grounded individuals. And I surround myself with individuals who I can almost see a part of myself in them. And all of these work in conjunction to keep me grounded and ultimately prevent me from getting burned out. Now, does it happen all the time? No, but I feel as if I'm doing the best that I can and doing what's in my capacity in order to make sure that I'm still able to wake up daily and serve my patients, but also waking up daily and serving myself. Because that's a thing that I feel as if some people forget to attend to sometime, and that can creep up on you. So find a good group of friends, stick to your nutrition, exercise consistently, sleep well, and find things that bring you joy and do those things consistently. My faculty mentors throughout entry level education, as well as residency education, continue to be some of the highly regarded individuals that I look up to and people that I instill confidence in that I can always reach out to with any struggles or questions that I might have. Also, clinical mentors. I still have a very good relationship with my CE3 mentor when I was living on Kauai, Hawaii. I still have a very close relationship with my CE4 mentor when I was working with the Denver Nuggets. And we communicate not all the time, but I always make an effort to reach out to them with any questions or to just check in. The APTA is always a great resource for advocacy. I had the pleasure of being an APTA leadership scholar, and this was a cohort of immaculate and incredible individuals who are so motivated and ambitious to elevate our profession and make us better and ultimately see us all succeed. And I still maintain a really good, close relationship with those individuals. Practices, again, I would fall on attending to my mental health and my fitness and my health and my well being in the forms of eating clean and meditation and continuing to learn, whether it be through reading research or continuing education classes or teaching in residency programs or entry level type of situations. I find that really fills my cup is being able to pass on the knowledge that I've gained. So I frequently volunteer through the Regis residency as well as entry level DPT programs to help educate these students and pass on the knowledge that I've learned. And that keeps me grounded and that keeps me motivated to keep pursuing this profession and elevating my practice and elevating the practitioner that I'm continuing to evolve into. The piece of advice that I would offer a future SURD scholar is that intentionality seeks serendipity. Essentially, this means that you have the power to create conditions for happy accidents and unexpected discoveries through deliberate action. This involves intentionally putting yourself in situations, maintaining an open and inquisitive mindset, and being prepared to recognize and act on unforeseen opportunities that arise. If you're able to lead with these type of perspectives, these will unequivocally open up doors to perspectives and aspects that will change your worldview on not only how you practice, how you see this profession, but ultimately life. My most meaningful experience I'm taking away as a rising tide surge scholar essentially is the message of hope. After interacting with this organization and being invited to join this organization and seeing how incredible the individuals are and how successful that they've become and how impactful that they've been for the field of physical therapy and for practitioners who look like me and practitioners who look like others and practitioners who come from different multicultural and ethnic backgrounds. This inspires hope for the profession that we can ultimately reach a wider range of patients, but also elevate the profession in the sense of making this a profession for everybody and a profession that everyone has access to.